Welcome to Public Health Matters, where we talk about matters in public health. I'm Jane Goodman, Public Health Network Strategist with the Nashua Division of Public Health and Community Services. Today I'm joined by Donna Lennon, Vice President of Clinical Operations at the Greater Nashua Mental Health Center. Welcome, Donna.
Thank you. Thanks for having me.
Well, we're just really delighted to have you here. We have a tough topic today. We've invited Donna to talk to us about alcohol use and alcohol misuse as we enter the holiday season. We do have a lot of celebrating to do, hopefully socially distanced and
Right.
in small crowds and with windows open. But we do have a lot of celebrating, and people tend to open a bottle of wine, or it makes for an occasion of drinking.
Mm-hmm.
There's a lot of football on and all of those things. So as a local expert on these things, first tell us what you do at, I've announced your title, but tell us what your responsibilities are at the Greater Nashua Mental Health Center.
The responsibilities are that I am managing primarily the directors of all of our programs. Mm-hmm. So we have a variety of programs for adults, older adult services, children and families, deaf and hard of hearing services.
Mm-hmm. And tell me a little bit more about the Greater Nashua Mental Health Center, like why we would invite someone on about alcohol use from your place.
Well, we've been in existence for over 100 years now.
Wow.
So we're a resource for 10 communities, outside of Nashua included. I don't know if I could name them all, but
yeah,
Milford, Mount Vernon, Hudson, yeah. So
and we do the same with the division. We have the Greater Nashua Public Health Network.
Yeah,
so.
Yeah, exactly. So we're here as a resource for people that are struggling with mental health issues and substance use disorders.
Mm-hmm. And they're often intertwined.
They're often intertwined. What we find is that many people who have a substance use disorder have an underlying mental health disorder. And then there's also concerns that when someone has continued use of alcohol or another drug, that tends to invite additional problems into their lives, including behavioral conditions mm-hmm. or mental health issues like depression and anxiety.
Mm. So it's deeply interwoven.
Yes.
As a problem. And I think it's interesting now. So we're still in the midst of a pandemic, but if we go back to last year when people were really still at home a lot, have you seen a difference between, this alcohol misuse and between, before the pandemic and now?
Yes, absolutely. We've seen an increase in usage. I want to say it was something like 54% increase. And we have also seen that trend with things like Hurricane Katrina and situations like that. Mm-hmm. But the pandemic, as you know, has brought, some unique circumstances that we don't see an end in sight. I mean, things mm-hmm. are getting a little better, that more people are getting vaccinated. But if we just think locally, the numbers are up on COVID. And so people use alcohol as to alter their moods to cope with stress. And mm-hmm. so what we often talk about is, are there healthier ways for you to manage stress instead of relying on a substance?
Mm-hmm. And it's difficult. I look at alcohol, I feel that it's taken a little bit of a backseat to some of our other substances.
Yes.
And maybe because it's a slower onset of disease and illness if you do use too much alcohol, if you do consume too much, versus some of these other opioids, for example. Yes. So some people call it like the silent killer because it's just slowly creeping up on people.
Absolutely. And I think that's an accurate perception because alcohol is still the number one killer mm-hmm. out of all the drugs. There's been a huge focus on the increase in opioid use disorder, but still the leading culprit for death and dying in the substance world is alcohol.
Yeah, and so that's an important reminder for people, and we'll talk about that a little bit, about, well, how do we know? How do we know if we're drinking too much or that kind of thing? But before I do that, because you did mention it is a significant problem. And there's other things that are caused too, with using too much, road accidents, premature deaths. We talked about the effects on family, which I know you want to talk about a little bit after, and then limited productivity if you're not feeling well the next day, you're not functioning at work. So there's a lot of costs to the side of, just even the long-term use.
Yes. There are a lot of things that can happen to a person when they get caught in the drug. So, for example, one of the things we don't talk a lot about is acquired addiction. So what we mean by that term is that, and I see this a lot, primarily with women, it happens with men as well, but from the years of doing therapy with women, primarily, I've heard a lot of this. So say, for example, someone comes home after work and they have a glass of wine while they're making dinner, and that's all well and good. There's nothing wrong with that. And then over time, they may go home, have the glass of wine while they're making dinner, and have a glass of wine with dinner. Still, okay, that's all right.
Not terrible.
Not terrible. We need to be careful, though, because according to the CDC, as females, we're at higher risk of developing medical problems like breast cancer and different types of cancer if we use too much alcohol.
Oh.
But in the case of acquired addiction, what we often hear is that then it turns into the kids are in bed and I'm going to have another glass of wine. Still may be okay if you're doing that once or twice a week, but what starts to happen is the body adapts to the drug and then it needs more of the drug to get the same effect that you used to get. So if you used to get a nice little buzz around 2 glasses of wine, you find that you don't really have an effect now. So you need that third or that 4th glass of wine. And before you know it, you've gone from having a bottle of wine a week to buying a box of wine to make sure there's enough in the house.
Wow. So we consider addiction for substances, specifically opioids, as a condition. You're predisposed to it. It's something, we don't know that if you take that painkiller that you're going to be that person that needs more. Is alcohol the same way?
It's the exact same way, yes. What happens with alcohol is for adults, it can be a long, slow progression into having a dependence. But for young people, it's a much more rapid progression because they're usually using another substance with it.
Okay.
So when someone does that, they are at a much higher risk of developing a tolerance and withdrawal symptoms and having problems in their life from their use.
So we have it not only in adults, but we also have a problem with our youth as well. So just before we move into all of that, so there are some just clear long-term health effects from alcohol. So I'm going to just start with one, like blackouts is one. Is that not necessarily when you're drinking? Could it just happen if you're not drinking at that moment, but because you've consumed so much in the past? Or?
Yeah, blackouts are a fascinating thing. When I was first working in the substance use field, we had a gentleman who came into the hospital I was working at, and I said something like, "So, do you still live on Main Street," or whatever it was? And he said, "How do you know that about me?" And I said, "Oh, well, I have your record from the last time you were here." And he said, "What is this, some kind of joke? I've never been here in my life." And so, in other words, someone had an interview with him where he was clear he did not appear to be impaired, but because of the use of alcohol, it impairs your memory, and so you have a blackout. Some people think blackout means you pass out.
That's what I thought.
Yeah, pass out is different than blackout.
Just kind of blacks out your memory.
Yeah, it's like a chemically induced amnesia. So certain things will happen, like in the later stages of alcohol dependence, people will often wake up and they need somebody to fill in, what did I do last night, or what did I say? Not like a hangover that could happen to somebody, a few times in their lives, but really having periods of time of not knowing who did I see last night, where did I leave the car, did I even go to work yesterday,
Wow.
Yeah.
It's fully loaded. And then we talk, you can have heart problems and high blood pressure as a result of it, pancreatitis.
Yes.
Which is probably something you don't want. And then this, what you're saying, permanent loss of memory. So that kind of goes with the blackouts a little bit.
Right. Well, it's chemically induced amnesia, so
Okay.
meaning that you have periods of time that you could be fully functioning and have your memory, but then you have other times after drinking where you have a lapse in memory. So it's
Okay.
not like you drink too much and suddenly there's no more memory, but it's during those episodes of heavy drinking.
Well, I just have to back up. So we talk a lot about terminology in public health and what's appropriate to say. Do we use the term alcoholic now, or do
Oh,
we?
what a great question.
Well, I just want to know for my own self, and as you look online and you look at some of these resources, really it's all over the map. Sometimes it's misuse, overuse. So you tell me.
Okay. Well, the current terminology is alcohol misuse.
Okay.
Or alcohol use disorder. We used to call it alcohol abuse or alcohol dependence. Now that we know more about it being a medical illness, we can call it an alcohol use disorder. But the other part of the conversation around mental health and substance use is what are the terminologies that we're using? Like, how do we refer to situations? And in order to reduce stigma, there's a lot of talk now about, do we have to call somebody an alcoholic? Do we have to call somebody a drug addict? Do we have to say to somebody, oh, they're a diabetic? Why do we do it when it comes to mental health or substance use disorders? And we don't have a tendency to do it with other things. So really just being careful with our language, like myself included. How many times have I said, oh, I just had a crazy day? Do I have to say I had a crazy day? Or can I say I had
that conversation in our office.
You know what I mean? Yeah, like, can I just say, oh, I had such a busy day, or do I have to use that term alcoholic? Now, in 12-step programs, it's appropriate and it's really helpful for people to come to terms with really owning this problem and accepting it, because if you don't accept it, you're at high risk of relapse, right?
Okay.
That's the thinking around it. So in the 12-step programs, that language is still used, although there's a lot of people now that are saying, I'm a person in long-term recovery, I'm a person in recovery from a substance use disorder, but most people in 12-step programs like AA will say, I'm so-and-so and I'm an alcoholic. So people will have a tendency to have a lot of shame around this stuff. They have shame around having a mental health problem or having a substance use problem. We have perceived it for so many years as like a moral weakness, or that we should be strong enough to combat these things on our own and not ask for help. And people are much more open to getting help now and talking more openly about these things. So we encourage people, tell your story. We all have times in our lives where we go through significant changes or stressful things or traumatic events. And we're all human, so we don't have to make judgment about what somebody's going through. And even in the case of someone who has a serious substance use disorder, that's a condition that they have. That's not who they are, right?
You got to separate the two.
Exactly. So we look at ourselves as kind of in a holistic sense, right? Like, to be well-rounded or balanced people, we should have some kind of spiritual part to ourselves, not necessarily religious, but maybe you feel better about life when you take a walk in the woods, or maybe you meditate, right? Where are you at vocationally? Do you like the work that you have? Do you feel proud that you earn enough money to put food on the table at night? How's your social life? Do you have some friends that you can confide in? Do you see your primary care doctor at least once a year for your physical health, right? I know I'm forgetting one, but you get the point that I'm talking about. We're holistic, whole people. And so, we could all have different diagnoses that are presented to us, but that is something that is a part of us, but it doesn't define who we are as a human being.
Yeah, so it's really, I just read this quote, and I don't know if I think it kind of relates, but it was in a novel, so it was not like a profound, poetic quote, but the person said, oh, I'm a bad person. He goes, no, nobody's a bad person. You're a person who might have done something bad.
Exactly.
And it was really an interesting way to just separate the two things, because when you give those labels, it's very difficult to get rid of them.
Yes.
And so that's why I asked, because, there's a lot of change in language in healthcare, and everything. And I don't think it's necessarily due to political correctness. I think it's due to understanding the science behind addiction.
Yes.
Science or dependence on a substance. So, and we do care because one thing that you said is this really can affect relationships with your family. So just let's talk about that a little bit. What does the family do, and how can they get help?
Well, one of the things that tends to happen is that when you love someone who has a problem, right, whether it's substance use or any kind of problem, the tendency is we want to help them solve it. And as the person gets more and more sick, we have a tendency to ramp it up, right? So we'll say, okay, they're not going to do anything about this, so I'm going to do this. So in other words, I'll call out sick for them because what are they, they can't, they're incapacitated from drinking last night or coming home at 3 in the morning or whatever. So we tend to make excuses for them or try to minimize the consequences for that person instead of maybe gathering together and doing a loving intervention with someone and saying that, this isn't working for me. I'm worrying too much about you. I'm not sleeping at night, or the kids are frightened by your behavior or what have you. So how can we all get help? So one of the things we suggest is family therapy. And a lot of times that might happen without the substance user being present because they may or may not be ready to get the help. So we encourage families, get the help for yourself, right? And then usually that person that's caught in the addictive process is kind of curious, like, you're not nagging at me anymore, you're not trying to control me, and you're happy in your life, and I want to be part of that. It doesn't always happen, but a lot of times it does happen, that when we kind of untangle ourselves in our role in being, co-addicted, if you will, in the process, it leaves room for that person to say, what were you telling me before about help? Where do I get that help? So that's one thing that could happen is family therapy, individual therapy. Also, they could go to Al-Anon or Nar-Anon. There's also a program now called Learn to Cope. It's primarily out of Massachusetts, but they're trying to open their meetings here. I want to say in Salem, but I'm not 100% on that. And those are places where we can openly talk about our own experiences of drinking or drug use that's gotten us into trouble, or we can talk about family members without shame.
And that can also be hard, for example, if you're around people. What if you're the one having the party and you have this person who's trying to be in recovery, but you want to have the wine, they don't want to have, how do you deal with that?
Oh, that's a great question, because
I'm just full of great questions.
yes, you are, which makes sense given what you're doing. But so what I often talk about with folks is how can you be prepared and go to the party and bring your own, non-alcoholic beverage, or I'm forgetting what you call them, but when they make the similar beverage, but it doesn't have the alcohol in it. Mocktail. That's
mocktail.
what I was thinking of. Yeah. Some people could do that. Other people can't do that because it's a trigger for them. That it's like, why am I wasting my time with this? Give me the real deal, right? But what people prefer is that they're not going to come into a house and everybody's going to stop talking and put them on the spot, but maybe saying to the person that invited them, lately I'm not using alcohol, so when I come to your house, it would be helpful if you didn't ask me if I'd like a drink, or
put one in front of me.
Or put one in front of me, yeah. Or just saying, I'm not gonna be drinking. Or when someone does put one in front of you, that you're saying, oh, thanks very much, I just got myself ginger ale. I'm good,
Yeah, so you really have to have tools to be prepared for those kind of situations, and on both sides.
Yes, and today it's much, much more accepting because, maybe years ago, or maybe it was because I was younger, you would have a tendency for to hear people say, oh, you're not drinking? Most people today, they don't care, and if someone does care that you're not drinking, it's often an indicator that, A, they're curious because they're in recovery, and now they got someone they can kind of identify with or talk with. But a lot of other times it's because they're afraid that if you're not drinking, you're going to pay more attention to the amount they are drinking, right? So they would rather have you drinking as a distraction so they don't feel like they're on the spot.
It limits the self-reflection.
Right, exactly.
Wow. So you had a few things that we talked about prior to this. You did talk about the alcohol abuse in women, that it's been going up. Are there any other reasons? I mean, you had described that scenario of, one while making dinner. Is there any other reason we think it's going up among women?
Well, I think one of there's probably a few reasons, but particularly during COVID, it's really gone up with women, like up in the 60% increase type of thing with women. And I mean, we can make some educated guesses about that, right? So one of them might be that women tend to be the primary caretaker. And so COVID hits and maybe they had to work remotely and the kids aren't going to school on a regular basis, or they weren't, right? So they're the primary caretaker. So they're trying to do their work. Some people had to learn how to develop their, computer skills and so on, and figure out how to do this remote work. So they're doing that. They're helping to school their children. They can't leave the children alone to go out and maybe grab a few groceries like they used to do on the way home from work every night. So their stress levels have been increasing. So that could be a part of it. The other part of it, you can have alcohol more accessible to you when you are home, right? So you can like stock up when you do get a chance to go out and shop. We also live in a state that, it was decided. It's on every corner. And it was decided that it was an essential business during the pandemic. It was considered essential,
right.
which is really remarkable. It's essential for the sales. I'm going to try not to go off on my political thing, but anyway, it's considered essential, right? So there's a message that we're giving to people with that. If you look at TV commercials, they still show commercials if somebody appears to be in a better mood after you give them a beer. So some of it has to do with there's more access to it. You could curb your drinking if you weren't in the advanced stages of an addiction, right? You could curb your drinking and say, I'm not going to drink till after 5 o'clock. Now you're home. So you might say, I'm going to have one at noon and I'm going to have a few more at 5 o'clock. That's one factor. Sometimes if marriages were having difficulties before the pandemic, and then maybe both partners are home, there might be more conflict and people turn to something to relieve their stress. And it takes a few minutes and it takes a different type of mentality to say, how can I take a deep breath for myself? Or I notice when I go in the backyard and look at the rose bushes, I feel a little bit better about myself and I do a better job and I'm not yelling at the kids. It's easier to reach for a drink or a substance than to learn how to really care for oneself and what we need.
Yeah. It's a difficult problem, really difficult.
It really is. And with many women, I've said to them, in therapy cases, what do you think you need? And they will usually look at me and they'll say, what do you mean? Because, we've been...
their needs last.
That's right. So our needs come last. So it's important for women to ask the question, what do I really need? And how can I share that need with somebody that I trust, whether it's a good friend, whether it is a therapist, whether if they are a religious person, where do I get that help and support to sometimes say, yeah, my hands are full, or today was a bad day with the kids. It's okay to say that. It doesn't make you a bad mom.
Right. Again, you've got to separate a bad day from a bad mom.
That's
You've
right.
got to separate these things. So just a few more things. What does a co-occurring disorder mean?
Co-occurring disorder refers to the fact that many people seeking help for a substance use disorder also have a mental health condition and vice versa. So we try to integrate the treatment. So in the old days, we'd say, oh, that person has a drinking or drug problem, so we have to only deal with that. We can't help them with the depression or the anxiety or whatever, bipolar illness, whatever. Now we've learned enough that we know we have to treat both at the same time. So we won't get very far if the person continues to use the substance, we're not going to get as far, and clients will eventually admit, yes, we're not getting to the goals that I have if they continue to use. So we usually try to help them with a primary focus on reducing the amount of consumption while we work on mental health issues, because there are some cases where someone might need psychiatric medication and it's not safe and it's not healthy to be using mood-altering substances like alcohol while you have a prescription. So with the comorbidity, what we're talking about is let's look at the whole person and let's treat that. Let's teach you how to work through anxiety. Let's teach you how to work through depression in a healthy way so that you're not turning to a substance.
It's a lot of hard work to reverse the course and to come out of this. So I really have a lot of admiration for people that manage to turn things around for themselves and for their families. Just finally, Donna, what are some of the resources in the Nashua area? I know we have the Doorway, beyond obviously your center. The Doorway, it's right on Main Street. A little bit about that? I think
Yes,
you can present
so
anytime.
anyone can call 211 or go to one of the Doorway locations across the state and ask for help. And they meet with the person, they get a preliminary assessment, and then they're linked with whatever the resources are for that particular person, what they might need. So one person might really need the safety of a detox, so they would help the person get into a detox. Someone else might be, in the beginning stages of realizing my alcohol use is really getting out of control. Where can I go for help? Some people will get, meeting lists of where other people attend meetings to help them cope. Some people get put into therapy, contacts, and that sort of thing.
Wow. And there are a lot of resources online, so I'm just going to mention a few of them. There's Granite State Recovery, of course, the Greater Nashua Mental Health Center, NAMI, New Hampshire. And we'll pop this up on the screen, but there is a nice website with all those resources that you shared with me prior to today. But we'll share that for people at home so that they can jot that down, and if they need some help. We could go on for a long time about this.
We really could.
Really interesting and a really important topic, and we just want to thank you.
Oh, you're very welcome.
For sharing, and I've learned a lot. And also, I just want to remind people we are going into this holiday season, so, think about, what we're doing and how we're, if it may be a time where we realize we need help. It may become magnified, it seems like.
Yes, and that there's a lot to be said about reaching out for help and not being ashamed that we all struggle from time to time in our lives. And, we're there for you.
Yeah.
I just encourage people to tap into that courage that we can all access and just reach out and ask for help.
Yeah,
because
it's okay
really
to
worth
ask for help, and
Yeah.
really important for our long-term health.
Yes.
Well, thank you, Donna. I hope you have a great Thanksgiving.
Thanks so much. Thank you.
And I hope you'll join us again.
I'd love that. Thank you.
And thank you all for joining us on Public Health Matters. Have a safe and healthy weekend.